What they don't tell you about tummy tucks. 60% of women develop abdominal muscle separation during pregnancy, and for many, no amount of crunches will fix it. So why are there so many women still told that diet and exercise are enough? If you've been doing all the right things, but your belly still feels weak, stretched, or just not the same, this video will help you understand why. Because when it comes to tummy tucks, what you don't know could be the difference between your final outcome and disappointment. Coming up in this video, you're going to learn 3 things that almost no one explains clearly, but could change your surgical journey. Why diet and exercise often fail after pregnancy, even if you're doing everything right. The 4 types of tummy tucks, the honest truth about who shouldn't get a tummy tuck, and the medical, emotional, and lifestyle factors that surgeons rarely talk about until after you've already paid for a consult. Stay with me. Knowing these things now could save you months of frustration and thousands in affordable revision surgery. Let me ask you to picture something simple. A hammock strung tightly between 2 trees. When the ropes are taut, it holds your weight, keeps you stable, and everything works as it should. Now imagine those ropes have stretched out after too many summers in the sun. They're slack, the middle of the hammock sags, and when you sit down, the support just isn't there anymore. That's your abdominal wall after pregnancy. The ropes are your fascia, the connective tissue that holds your rectus muscles in place. When that fascia stretches or tears, your muscles drift apart. This is what we call diastasis recti, and it happens to around 60% of women during pregnancy. But here's the part most people don't realize. You can't plank, crunch, or clean eat your fascia back together again. It's like expecting a frayed rope to tighten on its own. And that's why so many women are left feeling frustrated, unstable, and even ashamed when the problem was never theirs to fix with willpower alone. And this is where tummy tuck surgery, specifically functional abdominoplasty, comes in. Because this isn't just about aesthetics, it's about rebuilding the core of your body's support system. First, let's talk about the real reason your belly hasn't bounced back and why it's not your fault. We need to go beneath the surface to understand what's happening inside your core and why exercise alone doesn't work. Let's look deeper beneath the skin. Your abdominal consists of muscle and fascia, the internal scaffolding that supports your organs and posture. During pregnancy or major weight gain, the abdominal wall stretches. The fascia can tear microscopically and muscles separate down the midline. This is not something that you can train back into position. It's like trying to zip up a jacket with broken teeth. The function is lost. And when the skin stretches beyond its elastic limit, it loses recoil. Add hormonal effects like relaxin, which softens tissues for childbirth, and you get permanent structural change. No matter how disciplined your diet or intense your fitness, these changes can't be undone without surgery. Okay, now that you understand the underlying issue, let's talk solutions. Did you know there isn't just one tummy tuck? There are 4 distinct types, and picking the wrong one can mean poor results, extra scarring, or missed corrections. Mini tummy tuck is for minimal skin laxity below the navel only. It's a small scar and no muscle repair. It's great for small post-baby pooch. A full tummy tuck is the most common. It addresses both the upper and lower abdomen, includes muscle repair and skin removal, and it's ideal for post-pregnancy patients with diastasis. The extended tummy tuck is for those patients with side or flank laxity or post-weight loss patients. The incision extends beyond the hips. A fleur-de-lis abdominoplasty for massive weight loss patients adds a vertical incision to address the horizontal and vertical excess. This is the most dramatic but most visible scar. What determines the best option? Your body, not trends, not your surgeon's preferences, not what your friends had. This is where a tailored approach matters most. But before you get too excited, let's ask the hard question. Are you actually a good candidate for surgery? And this is where a lot of people get blindsided. So let's walk through what qualifies and disqualifies someone for abdominoplasty. Here's the truth many clinics won't advertise. Not everyone is ready for surgery. Here are the candidacy criteria. A BMI, usually less than 30. A high BMI equals high complication rates. No smoking because it impairs healing and increases necrosis risk. Need to have a stable weight. No major weight loss planned post-op. No major uncontrolled medical conditions, example, diabetes, cardiac disease. And no plans for future pregnancy. It could undo the repair. And there has to be psychological readiness. Your self-image and expectations must be realistic. Having previous surgeries, scar tissue may limit the results. And remember, these aren't barriers. They are protections to make sure your outcome is safe, durable, and satisfying. Let's go even deeper, because for many women, this isn't just about how you look, it's about how you function. Here's what really changes when we repair your abdominal wall, and it goes way beyond skin. When we restore the abdominal wall, your posture improves, lower back pain often reduces, you can breathe and move more efficiently, your pelvic floor and digestion benefit. Yes, the skin is tighter, but the real transformation, if you like, is feeling strong again. And finally, let's talk about the part nobody likes to hear, but everyone needs to hear, and that is the recovery. This is major surgery. You'll need time, patience, and planning. Let's break it down. A mini tummy tuck, you're looking at 1 to 2 weeks off work. A full tummy tuck, about 4 to 6 weeks. An extended or fleur-de-lis, even longer. You need compression garments, help with childcare, and time away from exercise. It's not a quick fix, but it's a permanent one if done right on the right body by the right hands. So now that you understand what a tummy tuck really is and whether it might be right for you, the next step is knowing how to prepare, because the best surgical results start before you even step into the operating room. In my next video, I'll walk you through how to prepare for abdominoplasty, what to do 4 weeks out, the lab work you'll need, how to mentally and physically prep, and what smart patients do before surgery to get the best possible outcomes. Watch that video next and take the next step forward, reclaiming your core, your confidence, and your body.